During my time as a journalist here in the desert, and even to this day, some of my biggest supporters have been in the LGBTQ plus community.
I moved here 10 years ago, and I think I fell in love with Palm Springs initially because I was here on a vacation. I was doing business in Los Angeles, and I came and I was driving down Tackwitz, and I saw these beautiful mountains and the palm trees, and I said, oh my God, I gotta live here. I just love this town because it's so accepting of people, even if you're not from here originally.
The city of transplants, and I think especially in the LGBT community, a lot of people have come from larger cities like LA, San Diego, San Francisco. The fact that there is a community, and historically the gay community has always had to seek out each other because there was so much stigma in the past. And this is one place where we feel, we call it a bubble, right? We feel where there really is hardly any stigma at all, and we can really be free to be ourselves.
Originally, maybe even 30, 40 years ago, the community started building here because they felt that this was a place where they could let their hair down.
The lifestyle of some male homosexuals has triggered an epidemic of a rare form of cancer.
Someone could be fired from their job, kicked out of their place of residence, and be on the street within 24 hours of people finding out they were positive.
Because of the HIV virus that I have attained, I will have to retire from the Lakers.
During the AIDS epidemic, which started in the early 80s, of course, getting HIV was a death sentence. We talked to a lot of people in this episode who lost many loved ones to AIDS and still to this day live with this immense amount of guilt that they themselves survived something that took the lives of people they loved. It's a tremendous weight, I've learned. Also, there's just so many social and emotional implications of living with HIV, and we're talking about living with HIV here in the Coachella Valley, Palm Springs, arguably the most inclusive place in the world for this community. So imagine what people who don't live in Palm Springs feel like. That's why it's just so critical to put an emphasis and have an understanding of LGBTQ plus healthcare. LGBTQ plus health, what does that mean to you?
Well, it's a variety of people. When you go to a community event and you see, or that caters to or has LGBTQ participants, you might see different varieties of dress, of style. I want them to come into my office at their level of comfortability. We give them that opportunity, and I give them that opportunity, and I feel we have a much better communication.
The education level of some of our youth in terms of sexual education is lacking. A lot of our young people had not even heard of HIV, which is kind of incredible.
Yeah.
Because we know that teenagers, folks start having sex in their teenage years, and it's scary to think that those vulnerable individuals are having sex without knowing the facts about what they could be at risk for and what services might be available to them.
Prevention is lacking. I mean, I think like the field is like changing a lot. You know, for about 10 years, we've been using oral HIV prevention medications. And now there's like a new injectable medication that you can just do like every 2 months. So educating about that and having access to that.
What are the biggest disparities?
Well, sometimes there is a stigma attached to having HIV sometimes, okay? And people don't want to necessarily let other people know their coworkers or family, whatnot. So it's something we really need to kind of protect. The fact that they're taking medications on a regular basis that perhaps may alert someone that they have some kind of a health issue, that they're really taking a lot of medication. There is a lot more that goes into their health care. So we really need to be vigilant for things that they might come across in their lives. You have to have an organization that is welcoming to the physicians and is so involved in the gay community as well.
In medicine, as like providers, we're supposed to be educating our patients in basically like their illnesses and everything that goes on in their lives so that we can actually promote better health outcomes in their lives.
One of the most important areas of disparity would be access to mental health. It's important for our LGBTQ community to be able to have therapists and psychiatrists, psychologists that are attuned to the issues that affect our community.
A good chunk of your patients here within DOHC are of the LGBTQ plus community. What would you say are some of the most pressing mental health issues that they're facing?
Well, I mean, in a broad way, they're probably facing the same things that everybody else is facing. The stress of our world today, the stress of being post-COVID, the loneliness that seems to be epidemic. Especially in a community that used to be so social, it does feel like after the pandemic, a lot of the social outlets are sort of dampened and it's harder for people to make connections. And so that's probably a lot of it. To care for them is to basically care for anybody, is to meet them where they are and be as non-judgmental and try and bring as little of your own values to the table as a doctor and try and figure out where their values are and how best to help them.
We've talked to some people who have survived HIV themselves, yet they've lost loved ones to AIDS, and that's a heavy burden to carry. How do people go about overcoming survivor's guilt?
Well, I mean, to be honest, I'm working with a lot of people in their 60s, 70s, and 80s that are dealing with the survivor's guilt, so I'm not really sure it's something they necessarily get over or get past, but work through. Imagine their experience of more than a decade of having no adequate treatment for an illness that was impacting their community far beyond most other communities. And, seeing their friends and loved ones die at a high rate. And then, many of them were even infected back when it was a very, very deadly thing. And nobody knows why some people were able to survive so long without an effective immune system versus other people that would succumb to the illness so quickly. And so there are a lot of people that are still thankfully alive now that you sort of were walking around expecting to pass, at any moment for up to a decade. And there isn't really any healing that kind of trauma. There's working with it and learning ways to live a fulfilling life while still dealing with it, but it's an injury that sticks with you.
It's interesting, Dr. Connolly pointed out that people in the LGBTQ plus community don't necessarily have different emotional wants or needs or struggles than people not in that community. Point being, We're all the same. We're all people who just want to feel loved, feel like we have purpose. But the difference is people in that community often are marginalized, right? So they don't get the same amount of support. They deserve to be able to talk about it and find peace in their life as well. I find it fascinating to learn that you used to teach and tutor underprivileged kids specifically, but now as a physician, a big passion of yours is education. It makes sense, and I love to hear that you're so passionate about helping teach the people you work with.
Yes. So I think that like in medicine, as like providers, we're supposed to be educating our patients in basically like their illnesses and, you know, everything that goes on in their lives so that we can actually promote better health outcomes in their lives.
In order to have that conversation about education, you need to feel safe to have that conversation, right? Which I think is why it's so important. DOHC, for example, having 5 doctors who are openly in the LGBTQ plus community, being able to treat those patients so you can just say everything, not feel like you have to hold back.
Like stigma free, basically, and in this kind of safe space. So I feel like whenever like I come out to my patients, there's just this sense of like relief, and they're like, oh, you know, and they can just open up and be themselves.
What are the repercussions down the line of a doctor not having that open conversation with their patient?
Yeah. So one of the things is you can miss someone being in the LGBTQ community, right? And so as gay men, you know, they engage in you know, like anal sex and stuff like that. And so when a patient can go to a provider and say, I need to get tested for an STD, they may just order a urine chlamydia gonorrhea test instead of actually doing like an anal swab or like an oral swab for that person as well. So long-term, you know, effects of that could be missing an anal STD that can actually end up causing proctitis down the line and other health problems.
What are you most proud of when it comes to DOHC and how inclusive their healthcare is?
So I love that we're basically becoming a part of this community. Yeah. And I love how, I mean, just how open about treating our LGBTQ patients we're becoming. I mean, we've been on the Pride Parade now for about 3 years, I think. And I think patients see that, and then they're more likely to seek care here. And also I love like the resources that we have here, just like on campus. It's wonderful.
Is it a rarity to see 5 doctors openly in the LGBTQ plus space?
I've never seen it.
Okay.
But yeah, I think it's probably pretty rare. Yeah, and I think it also speaks to how comfortable we are, like being here and being part of Desert Oasis, and just how supported we feel.
Talk about education with young people. How informed do you feel young people are when it comes to their sexual health?
Oh, that's a hard one, actually. I think for me, it's been like this even split. Like sometimes they're way too educated because they have such access to the internet and everything, and they're like constantly Googling everything.
Could be misinformation though, right?
Exactly, and that's like the thing. So they think they know a lot about something, and then it's like there's like this key thing missing.
Yes.
So
such a good way to put it.
Exactly, and then there's like other patients that are like, I don't know. So it's kind of hard to gauge it, but yeah.
Can you talk about some of the trends you're seeing with your aging patients?
So that's actually interesting too. So we actually have a lot of collaborations with other groups around the valley, like the Mizell Center and things like that. And so we do provide those resources for those patients as well. So,
I love that.
Yeah.
It's so inspiring to see how far inclusive healthcare has come when you look back years ago. Just now, for example, what DOHC is doing in this space, the programs they have, the resources they have, the fact that they just have so many openly gay doctors serving people in this community, helping those patients, which we know is so critical just to have those open, honest relationships and conversations between doctor and patient. I do find it surprising to learn just how much there still needs to change and how much work still needs to be done. I think that's why this clinical research that these doctors are doing is so important. Having conversations like this, using the platforms that we in this space have, I think that's all you can ask for and all you can do to create an even more inclusive Coachella Valley. Both of your organizations help people with HIV live longer, stronger, healthier lives, become the best versions of themselves. I understand Jeff Harp focuses a lot on these studies and has programs to really advance the medicine. I know there's social components to that as well, but an emphasis on advancing the medicine for the LGBTQ plus community, whereas Let's Kick ASS, AIDS survivor syndrome, you call it LCAPS, right, is what we call it, focuses a lot on the social and emotional resources available. I just want to start with HARP. Tell us about some of these studies that you're doing. What are you still trying to find answers to?
How HIV is affecting people as they get older. We didn't expect to get this old. Most of us who were diagnosed in the early years of the epidemic in the 80s and 90s were given literally a death sentence. I was told I had 2 years left to live back in 1988. So people are very surprised to be here.
Well, to this point, I was reading HARP saying in 2001, only 17% of Americans with HIV were 50 and up. Today, over 50% of people with HIV are 50 and up, and that's expected to go up to 75% by 2030. What is the force behind this longevity?
It's the effectiveness of the HIV meds. I mean, it's really a modern medical miracle that a disease that was discovered only 40 years ago, in the course of human history, to find effective medication in the course of 15 years. It was 1996 that we got what they call the cocktail of combination therapy that suddenly reversed it and stopped the HIV and allowed people to live healthy lives once again.
From a researcher's point of view, we could have said back in the mid-90s that there were going to be a large population of people aging with HIV. In the Coachella Valley, that 50% is really more like 60%. And so we never really prepared for it. And it's now that we've gotten to that level, for me, the important thing is to actually get our aging services organizations. I mean, HIV really came on the scene in the 80s, right? But we started solving issues regarding aging in the late 1960s when the President Johnson's administration had passed this Aging Act. So all of that infrastructure that's supporting aging services, that should be available to people who are aging with HIV as well. And part of my mission is to really make sure that there's a place for us in those aging services places.
Jeff, tell us about the bench that you're sitting on.
Timothy Ray Brown, he's known in the press as the Berlin patient. He's the first person who was ever cured of HIV. He was an American guy living in Berlin, hence the name, who had HIV, was successfully treated, doing well. But as sometimes happens with people with HIV, they're at greater risk for cancer. He developed a kind of leukemia and did not respond to his initial treatment. His oncologist in Berlin, he was not an AIDS researcher or a scientist, but he had heard about this rare mutation in Northern Europeans that can render them, their body's immune systems, immune to HIV. So he had the brilliant idea of, we've got to find a bone marrow donor for this person. Let's see if we can find someone who has that rare genetic mutation, who is also a genetic match for the bone marrow. It really was a needle in a haystack, and they succeeded. And Timothy took it. They had to do it several times, not because of the HIV, but because of his cancer, and it cured him. And he was the first person, and he very bravely came out. There was a huge media firestorm, as you can imagine, and he kind of became an accidental activist and an ambassador for HIV cure. Sadly, we lost him about 3 years ago when his cancer returned. He remained HIV negative, cured of HIV, but the cancer eventually took him. So we put this here to commemorate him as an ambassador of hope for HIV cure.
It says, in loving memory of Timothy Ray Brown, the first person cured of HIV who brought hope to the world. What do you feel sitting on the bench, being here in Wellness Park?
I always get emotional when I talk about it, but he and his partner were, other transplants. They came from Nevada and chose to be here, became very active in LCAPS and in positive life events. And then just recently, there's another person who's been cured of HIV, another Valley resident named Paul Edmonds. He's called the City of Hope patient because he got his cure at City of Hope just down the road. So there have been 5 people who've been officially cured of HIV now using that same process.
You're working at a place that proudly serves the LGBTQ plus community and has actual doctors in that community serving people in the community. Can you talk about why it's so important to have those doctors asking the right questions, being vulnerable, and just openly having important conversations with patients?
Well, word travels fast. So if we have doctors who understand the community and who might be a part of that community, we attract patients in the LGBT community because we know what we're talking about. We know what issues are important in our community, and we set up environments so that people in the LGBTQ community can feel safe. So I think it's important to set that environment up, and also when we're one-on-one with a patient, to be able to ask those questions, to have the courage to talk about their sexual practices, or whether or not they smoke or drink alcohol or use recreational drugs, or if they are sexually active, how many partners are they having sex with.
What are the repercussions of not having an open dialogue and not asking those hard questions?
Lots of repercussions, which would include public health. If you're not asking those questions of your patients, then you're not diagnosing their diseases, and those diseases can be spread in the community. For example, syphilis is at epidemic proportions right now. The incidence, which is number of new cases of syphilis, have increased 80% between 2018 and now. The fact that it's come back is probably multifactorial. It has probably a lot to do with the number of STD clinics that are available to test people. I think the COVID pandemic has also probably had an effect on the ability of people to get tested, but it's something that we can absolutely turn around.
What are some of the biggest disparities you see when it comes to healthcare for LGBTQ plus communities and those who are not in it? You wish the community had more mental health resources. What about opportunities for STI screenings?
I think there's a couple of organizations in town that do a great job of offering programs to our community in terms of STI screening, but I think you're right. I think that the number of locations that do that have decreased in the area, which probably puts our area at risk of having many pandemics of syphilis or gonorrhea or drug-resistant Shigella. I mean, there's so many things that happen in Coachella Valley that I think is probably in large part to not all providers feeling comfortable talking about sex issues, and not all providers testing their patients appropriately.
I guess it goes back to asking those hard questions, being comfortable, having those vulnerable conversations.
Asking the hard questions and willing to do the grunt work, which is swabbing someone's mouth and swabbing someone's bottom. It takes more than just, ordering something on the computer, or you actually have to do the work. And unfortunately, I don't think a lot of doctors do the work. And it's important to be able to do that.
Looking from then to now, what are some of the biggest changes you've been seeing when it comes to LGBTQ plus healthcare needs happening today?
I'm happy to say that we are actually starting an screening program for anal cancer. And we are hiring a nurse practitioner that is going to be doing high-resolution anoscopy. And I'll be supervising that person, and I'll also be doing a little bit of anoscopy too. And to be able to bring that kind of service to an organization is incredibly valuable, especially in an area like Palm Springs and Coachella Valley, where we have a scarcity of providers that can do that kind of work. And to be able to bring that kind of service to our organization is really cutting edge.
So it's been wonderful to learn of all the things that Desert Oasis Healthcare does for the LGBTQ plus community. Just so many offerings, ways to make everybody feel like this is a safe space. Let's just start with some of the things you're most proud of that DOHC does right now.
Well, when I first came here, I was one of the few gay doctors in the community, and so word of mouth spreads very quickly. Mm-hmm. And as a result, I started with a large population of gay men and gay women. And as the years have gone by, that's gone to complete LGB and now T, yes, which is interesting because that's a learning curve for me as well. Mm-hmm. Not having had the trans community that I was involved with only peripherally, and now it's actually something that I'm taking on, and I'm very happy to be able to kind of serve that community as well. And it's young, and it's definitely a younger population. I mean, I'm seeing kids in high school that are struggling with issues, and it's really a very fulfilling and satisfying part of my job now.
What are some of the resources that you're most proud of that DOHC offers the community?
As an organization, are very tuned in to a lot of the community organizations. I myself am and a couple of my other colleagues that you'll meet are also involved in an organization for HIV, living with HIV for a long time, or other community organizations that actually cater to the population.
I understand you spearhead clinical research as well.
Correct.
Which is vital just to advance medical research in this space. Tell us about it.
Well, yeah, I mean, I have been involved with clinical research here in our organization probably now for about 16 years. And over that time, we have become a little bit bigger and getting into more healthcare problems. And one of which we have in the past has been HIV. However, we didn't have the manpower to kind of help with that. And now with more physicians coming on, like some of my colleagues are very interested in that as well. And we hope to be able to expand our research, which is able to bring new treatments and cutting edge therapies to our population. And patients love it. They feel like they're getting, incredible care.
Yes.
And we have a very positive response to that. And we look forward to expanding that even more. So
there's a new program DOHC is creating for the community. Tell me about that.
Well, it's in its infancy stages right now, but the idea is that between our LGBT physicians, we're hoping to pool our resources and our knowledge and create a center of excellence for HIV, LGBTQ health as well, so that we have a multifaceted approach with not only healthcare, but mental health, social support, and health reimbursement support as well. We'll make access of our pharmacists who are also well trained in the HIV realm and LGBT realm, especially the trans. So this would be sort of a community center where a patient who is identifying with one of those particular subclasses can feel comfortable and know that they're getting the best optimal health care that they can.
It's so inspiring to see how far inclusive healthcare has come when you look back years ago. Just now, for example, what DOHC is doing in this space, the programs they have, the resources they have, the fact that they just have so many openly gay doctors serving people in this community, helping those patients, which we know is so critical just to have those open, honest relationships and conversations between doctor and patient. But I will say I do find it surprising to learn just how much there still needs to change and how much work still needs to be done. I think that's why this clinical research that these doctors are doing is so important. Having those conversations, having conversations like this, using the platforms that we in this space have to share these messages. I'm so proud of this episode of The Pulse. I think that's all you can ask for and all you can do to create an even more inclusive Coachella Valley.